Bismillahirrahmanirrahim. We're going to talk about Hodgkin lymphoma. Lymphoma means there is a malignant tumor that's found in the lymphatic system. There is no benign tumor that occurs in the lymphoma. Hodgkin disease is characteristic by their mutation in the B cells and T cells lymphocyte. The B cells are mainly that mutate and get enlarged and express some CD receptor in the membrane. They are called Reed-Steinberg cells according to scientists that discover these cells in the Hodgkin disease and become a characteristic sign to diagnose the Hodgkin disease between other types of the lymphoma. First, we're going to talk about pathogenesis. As we said, there is a mutation in the B cells and T cells. The B cells get mutated and get enlarged in the coordination to the normal lymphocyte, and there's abnormal receptor that express in their membrane. Some type of the lymphoma are linked to the injury or infection of the Epstein-Barr virus. Some people who are affected with the Epstein-Barr virus get, and after that, some type of lymphoma. Classification. The classification depends mainly on the morphology under the microscope. There are two types of the classification. Classic classification that characteristic by the found under the microscope of the Reed-Steinberg cells and CD15 and CD30 on their membrane. Non-classic characteristic by found of the Reed-Steinberg without the CD15 and 30. First, we are going to talk the classic classification. First type is the most common, nodular sclerosis. Sclerosis means hardening of the lymphoid tissue. Hardening comes from the fibrous band that form around the Reed-Steinberg cells. The Reed-Steinberg cells here are found to be have a clear cytoplasm with only nucleus inside. There is no cytoplasm in this type of the classic classification. Second type, mixed cellularity lymphoma. About 30% of the cases, there is no fibrous bands formed around the Reed-Steinberg. They have many types of cells that found in the specimen, eosinophils and other type of normal white cells. Third type, lymphoid rich, mean lymphocyte rich, normal lymphocyte that found in the specimen or under the microscope. Reed-Steinberg are low in count, so this type of the Hodgkin lymphoma have a good prognosis. This rarely occurs in this type of the lymphoma linked with the Epstein-Barr virus injury. Fourth type of the classic classification, lymphocyte depleted. It's characteristic by high number of the Reed-Steinberg in the ratio of the normal lymphocyte. So this type of lymphoma have a bad prognosis and slowly occur. And non-classic classification of Hodgkin lymphoma is called predominant lymphocyte, which have no CD15 and CD30 receptor in their membrane. They have another type of CD receptor. They call predominant lymphocyte because the lymphocyte have the major number according to the ratio to the Reed-Steinberg. The Reed-Steinberg have popcorn shape in this condition, and it have a good prognosis.
Signs and symptoms. So the lymph node enlargement most often occur in the cervical nodes, usually painless with rubbery consistency, and the pattern of spread is usually contagious. So for that reason, it can affect the spleen and the liver, leading to hepatomegaly and splenomegaly. Also systemic B symptoms, which are fever, sweat, and weight loss, usually more than 10% of body weight. Other symptoms include pruritus, fatigue, anorexia, and occasionally alcohol-induced pain at the site of enlarged lymph node, as we said, at the cervical lymph node. Symptoms due to involvement of the other organs, for example, involvement of mediastinum leading to cough and breathlessness. Laboratory diagnosis must be distinguished from non-cancerous causes of lymph node swelling and from other type of cancer. First test is the blood test. CBC assesses the function of most organs and safety for drugs and chemotherapy. Second, which is positron emission tomography. Using a positron to make an image of body cavity is used to detect small deposits that do not show on CT scanning. Also, it can produce an functional imaging. Third, gallium scan, sometimes used instead of positron emission tomography. A nuclear medicine test uses a special camera to take picture of specific tissue in the body after radioactive tracer with a radionuclide or radioisotope makes them visible. Fourth, pathology using the biopsy, macroscopic or gross picture. Enlarged lymph node with preserved shape because the capsule not involved. Also, when we do a CAT survey, it will appear like white-gray uniform. Some type nodular sclerosis. Usually affects lateral cervical lymph node. Under the microscope, we will see lymph node architecture will show the picture of scattered large malignant cells known as Reed-Sternberg cells. The Reed-Sternberg cells within a reactive cell infiltrated, usually composed with the lymphocyte and histocyte, eosinophil, and plasma cell, as described before. Characterized of classic Reed-Sternberg cells include large size, between 20 to 50 micrometers, abundant amphiphilic two mirror image nuclei, each with an eosinophilic nucleus and a thick nuclear membrane.
Staging and treatment. The treatment mainly depends on the staging of the disease. First, we have stage 1, which is involvement of a single lymph node, region, or lymphoid structure such as spleen, thymus, Wilder ring. Stage 2, which is involvement of 2 or more lymph node regions on the same side of the diaphragm. Stage 3, which is involvement of lymph node regions on both sides of the diaphragm. We're going to divide into 2 subtypes, with or without involvement of spleen or hilar, celiac or portal nodes. The second type will be the involvement of para-aortic, iliac or mesenteric nodes. The fourth stage, which is involvement of an extranodal site. In adults, the treatment is being grouped into 2 main groups: early and advanced, and each one is being subtyped into 2 types: early favorable, unfavorable, which includes stage 1 and 2, advanced favorable, unfavorable, which includes stage 3 and 4. The early favorable includes stage 1 or 2 without the risk factor, which we are going to discuss. Early unfavorable, stage 1 or 2 patients with 1 or more of the following risk factors: chest tumor, which is larger than third of the width of the chest, metastasis to an organ other than the lymph nodes, a high sedimentation rate of RBC, 3 or more lymph nodes with cancer cells, symptoms, B symptoms such as fever, weight loss, or night sweats. The advanced level, which is subdivided into favorable and unfavorable. The favorable, with the patient being stage 3 or 4, with 3 or fewer of these risk factors, which help in determining the prognosis of the patient, being a male, 45 years or older, having stage 4 disease, having a low blood albumin level, a low hemoglobin level, a high white blood cell count, a low lymphocyte count. The advanced unfavorable, which includes stage 3 or 4 with 4 or more of the previous mentioned risk factors. We have 3 standard treatments to the adults: chemotherapy, radiation, and surgery, which being used respectively. For pregnant patients, we will wait and watch, because we don't want to affect the embryo with the chemotherapy nor with the radiotherapy. If there is progression, we use steroid therapy. There are new types which are being tested in clinical trials for adults, such as high-dose chemotherapy and radiation with stem cell transplant, and low-dose chemotherapy and radiation with stem cell transplant. In children, there are 5 standard treatment: chemotherapy, radiation, targeted therapy, which targets the affected organs, surgery, and high-dose chemotherapy with stem cell transplant. New types of treatment are being tested in clinical trials for children, which is a type of radiotherapy, proton beam radiation therapy. Last but not least, the prognosis. The international prognostic factors project on the advanced Hodgkin disease. There are 7 factors which we discussed before, and they affect the prognosis of the patient. And the more the factors are met, the worse the outlook, and more likely the patient will need aggressive treatment. Factors are used to predict the success of the patient treatment with relapse or persistent Hodgkin disease who are undergoing stem cell transplantation. Thanks for watching. Hope you learned something useful.